Hello students, today we will discuss the second portion of the antidotes in poisoning. Last time we discussed about the poisons, what are the mechanisms of action of poison, uh, and what are the terminologies that are used when we discuss the poison. Similarly, today we will see the details regarding the antidotes. Antidotes, as defined by the International Program of Chemical Safety, they are the therapeutic agents that counteract the toxic effect of the drug or the poison. So, whatever untoward, undesirable, and uncomfortable uh, effects of a drug or poison accidentally consumed by a person, they are managed by the administration of suitable antidotes. So, antidotes are the agents that modify the kinetics of the toxic substance or interfere with the effect at receptor site. So, this may be as a result of prevention of the absorption, binding, and neutralizing the poison directly, or antagonizing its end organ effect, or inhibition of conversion to more toxic metabolites. So, in this way, the antidotes counter the harmful effect of the poison. Now let us see regarding the therapeutic index. So we know that therapeutic index is the ratio of therapeutic dose to effective dose. That means lethal dose, toxic dose to effective dose. So the ratio of the lethal dose to effective dose is known as the therapeutic index. Effective dose is the minimum concentration of the drug that is required to show a pharmacological effect in the body. And lethal dose is the toxic dose that is uh, that shows a toxic effect in the body. So, based on this, an antidote has also been defined as an agent that increases the mean lethal dose of a toxin. So, that means we already know that poisons, to behave as a poison, the substance dose is very important. So, if the dose of the drug is high, then it is minimum chances that it will act as a poison. And a harmful poison or a lethal poison is such which can produce harmful effects in the minimum dose. Then it will be very harmful or toxic to the body. When antidotes are administered appropriately, they may limit morbidity and mortality. Morbidity is the condition of the body, and mortality is nearness to the death. Now let us see what are the modes of action of antidotes. Formation of inert complex. Some antidotes, they counter the effect of the poisons by chelating the heavy metals in case of heavy metal poisoning, or example is dicobalt edentate for cyanopoisoning. So when a person consumes cyanide ion or cyanide substances as a poison, then dicobalt edentate, it will chelate the cyano substance and it will render it ineffective as a poison. So the activity of the available drug is reduced, and that is why now this dicobalt edentate will behave as antidote. Another mechanism of action is accelerated detoxification. The example for this is the antidote thiosulfate, which is used against cyanide again. So cyanide के लिए thiosulfate drugs are also used as a antidote because it will detoxify, it will reduce the absorption of cyanide in the body. The another mode of action of antidote is by reducing the toxic conversion. For example, methanol poisoning happens when people consume the substandard or methanol containing alcohol. Then use of ethanol is the antidote for methanol poisoning. What happens is that methanol is oxidized in the body to methaldehyde and formic acid. In the liver, it causes toxic reaction, and as a result the patient can have a loss of sight, loss of vision. So this, and even death if it is in large quantities. So ethanol, what happens is ethanol gets oxidized, it reduces the conversion of methanol to formaldehyde, and and this reduced, the toxic conversion is reduced by the presence of ethanol. Another method of action of antidotes is the blockage of receptor site by competitive antagonism. So what is competitive antagonism? There is one receptor site and there are two chemical entities which are competing for the same receptor site. So if the poison behaves or acts by method of binding with the receptor site, the antidote, it will bind first and it will not allow the poison to bind with the receptor site. Now since the receptor site is no longer available and the complex between the poison and the receptor site could not be made, so that is why poison is not, cannot show its toxic effect, and it will be excreted out of the body in the such manner. So this is the examples for blockage receptors is naloxone for in case of opiate poisoning, atropine in case of organophosphate poisoning, flumazenil in case of benzodiazepine poisoning. So we know that opiate, codeine, morphine, drug substance of abuse, they may contain opiate, and otherwise in some places people consume opiate for various reasons. So naloxone is used as an antidote for opiate poisoning. Organophosphorus compounds, organophosphates are normally used as insecticides and pesticides by farmers. So when they are not using the appropriate human gear, protective gear, then in that case they may inhale accidentally or they may consume accidentally the organophosphorus compounds and poisoning may happen. So at that time atropine sulfate injection is used for this organophosphorus poisoning. Now another mode of action for the effect of antidote is by enzyme inhibition. So many drugs, they act by inhibiting certain enzymes. Example, warfarin. So warfarin is an anticoagulant and it is administered before, generally before the operations, and people where who have some cardiovascular means the artery blockage and other things, so that time warfarin and other anticoagulants are used. So specifically for warfarin, vitamin K is used as antidote, and isoniazid, for isoniazid poisoning, vitamin B6 is used as antidote. For methotrexate and pyrimethamine poisoning, folinic acid is used as an antidote. So these are the vitamins and biomolecules which act by enzyme inhibition, and they act as a antidotes for such drugs. Another method of action of antidotes is by replenishing the antioxidant defense. So antioxidants are very important for the body, and when the, because of the poisoning, the level of antioxidants in the body go less. So that is why if we replenish the antioxidant defense mechanism by drugs like an acetylcysteine, so acetaminophen, which is paracetamol, in case of poisoning of paracetamol, the we know that, and if the antioxidant level is more than paracetamol or acetaminophen, will not be able to act. So acetylcysteine, which is an antioxidant molecule widely used, and this acts as a antidote for acetaminophen poisoning. The last common mode of action for the antidotes is by reducing the effective concentration of poison. Like example, activated charcoal, chelating agents, etc. for various chemicals. Now, what does these do? Activated charcoal, it will absorb the poison, and that is why the available poison, for showing the effect, the concentration of the available poison is lowered, and this is insufficient to show the much toxic effect of the poison. So these are the common 8 methods by which normally antioxidants act. Now, the classification of antioxidant antidotes. They all the antidotes can be classified into four types. First is mechanical or physical antidote. Second, chemical antidote. Third, physiological or pharmacological antidote. And fourth is the universal antidote. So these are the classification of antidotes, general classification, and we will see what are the what the each category in detail. The physical antidote or mechanical antidote, they are named such because they don't produce any chemical action in the body or reactive action in the body. They will act by showing the physical phenomena like adsorption, covering up, forming a lining. So they are not reacting chemically with the tissues or with the poison. In this way, we can say that the mechanical or physical antidotes, they neutralize the poison and they also help stop the absorption of poison in the body or create a barrier between the poison and the tissue. They can be subdivided on the basis of their function as activated charcoal, demulcent, bulky food. Let us see activated charcoal as an antidote. So it is a very renowned and very well accepted antidote for most of the substances. We know that activated charcoal is a fine black color, odorless powder. It does not have any odor and it has a very small particle size. That is why the surface area is very large. It acts by absorbing the poison on its surface from the stomach. So generally, in case of food poisoning, in case of some metal poisoning, in case of drug poisoning, activated charcoal is always used. Particularly, it is beneficial in absorbing the alkaloidal poisons such as strychnine and a lesser degree mineral poisons. In multiple doses, it significantly increases the total body clearance of opium, cyanide, and phenobarbital. Phenol, salicylates, kerosene, and paracetamol are not that much absorbed and they are moderately absorbed. So the limitation of activated charcoal is that it is not very useful in dealing with the cases of corrosives, heavy metals, hydrocarbon and alcohol poisoning, and we may need the other type of chemical based antidotes for such poisoning. If we talk about the dose required for activated charcoal is generally 30 to 60 grams in case of children and 60 to 100 grams in case of adults in 5 times the quantity of water. So if we are taking 20 grams, we have to take 100 ml of water minimum. So the correct dose of activated charcoal is about 5 to 10 times of the amount of drug that is ingested, because we need more 5 to 10 times of the activated charcoal to absorb the entire drug on the surface. So if a person has consumed say 1 gram of the poison, then 5 grams of minimum 5 to 10 grams of activated charcoal may be given to act as antidote and to absorb or minimize the poisonous effect of the substance. The second physical antidote is demulcent. So demulcent form a protective coating on the gastric mucous membrane, thus preventing the damage caused by the poison. Examples are egg, milk, albumin, oils. But oils cannot be used for oil soluble poison like kerosene, phosphorus, organophosphorus compounds, DDT, aniline, etc. So because they both act in the same manner, both will be corrosive and irritant. Okay, so effect of poisoning will increase. So we have to be little mindful when knowing if we know the type of poisoning. So accordingly we have to choose the antidote. The third physical antidote is bulky food, consumption of bulky food. Example like lot of bread, isabgol, banana, which is bulky in nature. It will swell up in the our body organs, and they will act as a mechanical antidote to imprison, to form a coat around the particles of the poison, and thereby it will create a barrier and it will be excreted out from the body as such. Now, chemical antidotes, they inhibit the action of poison by forming harmless or insoluble compounds. So it is a chemical reaction that happens, and now the product of this chemical reaction will make the initial poison ineffective. Like example, potassium permanganate, which is a strong oxidizing agent. So if a person has consumed a basic poison, the poison of base nature, like example opium and its derivatives, strychnine, alkaloidal bases, so they are all base in nature, and that is why if we are consuming the potassium permanganate, which is strong oxidizing agent, it will form complex with this, and the poisonous effect will be reduced. So these are, you can see that this is the potassium permanganate and opium, atropine, cyanide poisoning. So a dilute solution, that is 1 to 5,000 times, means a very dilute solution of KMNO4 will be effective against these poisons. Now examples of chemical antidote, the other example is strong tea. So it's very good because we know that tannins are chelating agents, and tannins which is present in strong tea in a good amount. The strong tea means without milk but boiled tea, only black tea. It produces the insoluble compounds with most of the alkaloids, glycosides and metals. And even common salt, NaCl, it decomposes the silver nitrate by direct chemical action, forming the insoluble silver chloride. A solution of tincture iodine or Lugol solution to half a glass of warm water precipitates most of the alkaloids, lead, mercury, silver, quinine, strychnine, all the alkaloidal bases. So these particular chemical antidotes are very good to neutralize the poisoning cases of alkaloidal bases. Now acid also, I have already told you, acids neutralize the alkali by direct chemical action. So only those substances which are harmless by themselves should be given, because acids themselves are corrosive in nature, should not give the strong acids. But we know some acidic substances like lemon juice, vinegar, etc., they can be taken for neutralization of alkaloidal bases or alkali poisoning substances. Now next is the physiological and pharmacological antidotes. This is a third category of antidotes. Now they act on the principle of antagonism. So action is reversed. The pharmacological action of the poison is reversed by these drugs. Example is, if a poison is having a muscle relaxant property, this antidote will have a muscle contraction activity. So it will neutralize the or antagonize the effect of the pharmacological action of the poison. So but they are all means partial antagonist only. They act on tissues of the body and produce symptoms exactly opposite. So their use is limited. Examples are cyanide, amyl nitrite, barbiturates, picrotoxin and amphetamine. They are all kind of antidotes, chemical antidotes of opposing nature. Now coming to the last category is the universal antidote. The fourth category of antidote is the universal antidote, and this is the most important uh, antidote when it comes, because from traditional knowledge also we can find this antidote used before, like 100-200 years ago also universal antidote was administered by most of the pharmacists and medical practitioners. So when it is used, and universal antidote is used when the nature of poisoning is unknown. So we don't know what type of poison the body has consumed, and because earlier types we saw, we knew that what is the nature of the poison, and accordingly the treatment or the antidote was selected. But here, if we don't know, in most of the cases we do not know what is the nature of poisoning, because the person consumes the poison and then he is under a state of shock or uncooperative behavioral this one. So he is not able to tell what he has consumed, and maybe in the unconscious state. So that is why the nature of the poison is not known. So what we do is we make a mixture of three types of antidotes. One is the physical antidote, that is the activated charcoal. We take 2 parts of activated charcoal, mix it with 1 part of acid neutralization type of means chemical antidote, that is the magnesium oxide. And the third is the tannic acid. So it will chelate and it will precipitate the substances. So this we make a mixture 2 is to 1 is to 1 ratio, and we consume with a glass of water, and it may once or twice a day as per the requirement. So most of the poisons can be tackled by using this mm, antidote. Now at all the time we may not be able to mix the three substances. So we what we can do for the activated charcoal, we take a toast, the hard toast, and we burn it completely. We burn the bread and it will be converted into charcoal. That is the hard toast that is available. We will burn it and we take 2 parts of this powder, mix it with 1 part of milk of magnesia, which is available in the form of laxative in most of the homes, and we mix it with strong tea. So we take 1 glass of water and add 3 to 4 spoons of tea uh, powder, and we boil it for 5 to 10 minutes. This is a strong tea full of tannins, and if we mix 2 is to 1 is to 1 proportion, we will get the universal antidote. We consume it with a glass of water. Now, when should an antidote be administered? So it is very important question and thoughtful question, because most of the time the person who has consumed the poison may be isolated or maybe in an unconscious state. So already there is a delay. By the time the person is carried to a poison treatment center or a healthcare center, lot of time has passed. So antidotes that decrease the toxin level by reducing the absorption are generally beneficial if administered early, because the chemical reaction has to take fast and the effect of the poison has to be reversed. But antidotes that modify the toxic metabolites, they can be given at variable times. So the treatment has to be strategized in a thoughtful manner by the healthcare practitioner. Now example is like, say for example, this is a table that is available. So there are the three ABC, which is known as 3 R's. That means reduce, restore, and rescue and support. These are the 3 stages of care that is to be taken in case of handling poison cases, when we handle the poison cases. So first we have to reduce the dose. How we can reduce the dose? By administering the activated charcoal. So most of the drug which is unabsorbed by the body will get absorbed on the activated charcoal and available in a less proportion for to be mixed with blood and to show the effect. Second is by restoring the function. That means example is like folinic acid, vitamin K, which will act as a receptor binding site and cause the drug to be ineffective. Next is to rescue and support. So when, like for example, clotting factor and colony stimulant, these all are the toxins, the factors that are to be considered when we are taking the care for the patients. Example, benzodiazepine under poisoning. How long should an antidote be administered for? So it depends on the type of the toxin consumed or the type of the poison, the estimated dose that is consumed by the individual for poisoning, the route of exposure, the clinical features or symptoms of toxicity, the half-life of the poison, and the pharmacokinetic behavior of that poison, and risk versus benefit. So it's very symptomatic treatment that needs to be given in case of poison. So uh, general practitioner is the best person to diagnose and prescribe the therapy. What is the evidence of efficacy of antidote? So we know that antidotes, as antidotes, the evidence, there is very minimum evidence is available for to study the efficacy of antidote, like which antidote is better and all or best, because there cannot be any clinical trials for this. So registered clinical trials are not available, because who will come to get under trial for testing of the poisons? Of course nobody. So whatever data we are having may be for the animals, which may or may not be true for human beings. So that is why a limited evidence is available, and we know for the obvious reasons. Now chelating agents as antidotes, they are normally used for heavy metal poisoning, example EDTA, BAL, that is British anti-levisite, and penicillamine. These are the three chelating agents which are used as antidotes. And if we talk about EDTA, it is a widely prescribed antidote that is effective for most of the cases of metal poisoning and heavy metal poisoning like arsenic, lead, etc. And in case of lead poisoning, the dose is around 20 microgram per dl of blood given by IV or IM. And lead poisoning, for adults it is greater than 70 microgram per DL. It combined with dimercaprol, that is a BAL. So EDTA is always administered before the BAL or dimercaprol. So it is FDA approved. EDTA is approved by the FDA for the treatment of lead poisoning in adults and in children. We know that lead can be sometimes mixed in the drinking water also. There are so many cases around the world for lead poisoning. Poorly absorbed through GIT, and therefore it is administered through IM injection or IV infusion. It cannot be given orally because it is poorly absorbed in the GIT. And the dose of EDTA is based on the body surface area and the renal function status. Dimercaprol, also known as BAL, that is British anti-levisite, it is available as injection and it is contraindicated for the treatment of cadmium poisoning and mercury poisoning because it is already a compound of mercury only, and it is administered as 5% solution in RHS oil given by intramuscular injection. It can be a treatment for poisoning with heavy metals like arsenic, gold, lead or mercury. Originally developed to counteract arsenic containing war gases, but now it is used as an antidote. Penicillamine, it is the second line of treatment, but it is not now in use, and because it is a kind of copper chelator. Penicillamine will chelate with the copper, and penicillamine has FDA approval for Wilson disease and cystinuria, and it is used as an off-label treatment for lead poisoning in children. So it comes as a oral capsule or a tablet which is to be taken by mouth and on empty stomach. So this is all the details with the antidotes, and before that in video 1 we discussed about the poisons. So again I would like to repeat that what is there that is not poison. All the things are poison and nothing is without poison. So it is only the dose that determines a thing is not a poison. So each and every chemical that our body consumes may have medicinal activity, also poison activity, if the dose is not controlled or observed. So with this, thank you very much for this second video. So we have got total 2 videos to cover the topic of antidotes in poisoning. Thank you.